Let's talk to the chief executive of the Birmingham-based healthcare management solutions company. They operate around 80 care homes across the UK. Tony Stein. Good evening, Tony.
Good evening, Kevin.
Now, if I was you, this is what I'd be very annoyed about with Sajid Javid there, getting all high and mighty about care home staff for whom he made the double jab mandatory, or the health department made it mandatory. If you don't get double jab, you can't work in care homes because old people who live in care homes are vulnerable. We could debate whether or not that's a good idea, but that's a different issue. That's what the situation is, and the reason given was because old people are vulnerable. So mandatory double jabs for all of your staff. Meanwhile, at the NHS, no such requirement. No need to get vaccinated at all at the NHS. And why is he getting all tough with your staff, saying no jab, no job? Because in the end, we can live with that situation as a nation. If he got tough with NHS workers and said no jab, no job, it is estimated that more than 100,000 NHS staff would have to lose their job immediately because they're refusing the vaccine. And if they all lost their job, the NHS would cease to function. So it's tough talking for you, but not the NHS. That must be very irksome for you.
I think it speaks loudly to how social care is viewed compared with the NHS, doesn't it? The NHS is the country's sacred cow, and politicians love to splash cash on the NHS because it does well for them. But I think social care has always been the poor relation, and I thought genuinely over the last 2 years we've demonstrated in the social care sector how important we really are to the nation. We're an intrinsic part of the healthcare system. The staff are very well trained. They work very, very hard. They took some incredible risks personally during the pandemic to look after the people that they care for. And I thought that we were starting as a nation to change that view of social care, but it seems not, doesn't it?
Well, look, the thing is, everybody has the right to decide whether or not they want the vaccine. I mean, that's a sacred human right to make a decision about whether or not you undergo a medical process. So this is not the time to get into a debate about why people might decide that. They've got the right to do it. Now, presumably at your 80 care homes, for whatever reason, these people haven't taken the vaccine, but you would insist on them getting tests every day. So given that your residents and the rest of the staff are double vaccinated and therefore have some degree of protection, and that your non-vaccinated staff would agree to be tested every day, what's the problem? Why can't they carry on working for you and keeping your care homes going?
Well, Kevin, I think, we always took a view right from the very beginning. We didn't want the vaccine to become mandatory. We went down a different route, and we started very, very early on in the pandemic, trying to provide our staff with the right information. There's a lot of rubbish out there on social media that genuinely made people scared to get vaccinated. And we've had an incredible success rate in getting people to become vaccinated, and that was simply through signposting them to good information. So out of the 2,600, 2,700 staff that we've had over the last 2 years, we are going to lose 31 people at the 11th of November. We're going to have to make those people redundant. We just have to dismiss them because they won't be vaccinated. So I don't think, when you look at those numbers, that speaks highly, I think, to the fact that, we got a very, very high level of you can call it compliance, of people wanting to become vaccinated. The fact is, though, that this is a sector which has staffing problems, and we've had staffing problems for a lot of years, and this is just another 30 odd people that we've invested in, that we've trained, that have got experience, but more importantly, that have cared for and developed relationships with those residents in our homes that we're going to lose and we're going to have to replace at a very difficult time. And like you said, there are other ways of handling the situation with those 30 people. And I genuinely believe that over the next few months, as more and more people that they know, their relatives, their friends, get vaccinated, they probably would have decided to get vaccinated. But it does send a very different message, doesn't it, when you mandate it, when you tell people that unless you take the vaccination, you lose your job. That's something that we were quite happy not to do.
It's strong-arm coercion, isn't it? It's strong-arm coercion, which I think is wrong. I mean, people have the right to make this decision about their own bodies, and I don't think the government should be getting involved in trying to coerce them to change their mind. But what I would suggest to you, Tony, is your industry, the care home industry, is taking the brunt of this, so that Sajid Javid and the government can act like they're tough talking. No jab, no job. But they haven't got the guts to do it in the NHS. They say no jab, no job because your old residents are vulnerable. Fair enough. I'll tell you another class of people who are vulnerable. That's patients in hospitals. And yet, no jab, no job doesn't exist in hospitals. It doesn't exist in the NHS, and that is because they cannot afford to bring in a mandatory vaccine rule for NHS staff, because too many of them would have to leave the service, and that would mean that the service would fall apart at the seams. So you are a victim of a government that wants to talk tough, but actually, when it comes to the NHS, is incapable of walking tough.
Yeah, I think that there's some truth in that. I suspect that over time, it'll become mandatory in the NHS as well. My big problem with this is that I think there were ways, and we've demonstrated that in our organisation. There were ways of taking people along with us, and that's worked. And as I said, we're down to 30 people now that are going to have to lose their jobs, and that's a crying shame for a lot of people, not just the staff, but for those residents they care for. And I think over time we probably would have managed to get them, to persuade them or whatever to go along with us. And as you say, there are other ways of dealing with it. I think what worries me a little bit is, as always with social care, is that there are some serious underlying problems that need to be addressed and that aren't being addressed. Again, I was punching the air when we had the tax increase that's to help fund the social care sector. When they announced the NI increase, but actually, it probably lasted about 24 hours until we started to realise that yet again the money was probably going to be diverted into the NHS, and then it was going to probably end up being fed to local authorities to be pushed down towards care home operators, and a lot of those local authorities will probably hang on to some of that money. So by the time it actually filters through to social care, I suspect that the proceeds of that tax increase will be significantly diminished, and we'll be struggling yet again to fund care properly. There are local authorities out there that are close to bankrupt and can't deliver the care they need to deliver. Yeah. So if they get some extra cash, I suspect that's not going to flow through to us. This sector's in a difficult spot, and it needed some really joined up thinking, and I'm not sure that we're getting all of that.
Yeah, just a sort of blanket ban was not what it required. I would have thought, as you suggested, or as I suggested, regular testing on the part of the refuseniks, given that all the rest of the staff are double jabbed, the residents are double jabbed. We know that even if you are double jabbed, you can still pass it on, you can still catch it. So all in all, being vaccinated is not the be all and end all. Tony, thank you very much for your time, and I wish you all the best for your business in these difficult circumstances. Tony Stein there, Chief Executive of the Birmingham-based Healthcare Management Solutions Company. They operate around 80 homes across the UK. And when we come back, we'll be talking